Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Of a report that was done by the OIG, and this is old now. It was done in about 10 years ago. But that this report kind of led to what we live with today relative to national coverage decisions and local coverage decisions related to nails. And so this was a report that kind of went into the Medicare was spending a lot of money on nail debridement services, and so they did a report looking at it to see exactly what it was made up of. So on slide number 3, I just kind of highlighted some of the things that they found, that the nail debridements were one of the top 25 Medicare reimbursable services. So of all the services that Medicare reimburses, the nail debridement codes were in the top 25. Nail debridement was a quarter of all of the Medicare payments to podiatrists in the year 2000. And of the $1 billion paid to podiatrists, $233 million were paid for nail debridement. 96.8 of that $233 million was paid inappropriately, and 22.7% of the carriers at that time had no medical justification. And so that is why they went ahead and started creating different guidelines and rules relative to foot care that sometimes will relate to podiatrists and sometimes will not. And we'll talk about that today also. Something a little bit more current that came out is all listed on slide 4. CMS granted a contract to Safeguard Services in 2010, and I've given you their Safeguard Services website, which has all of the information relative to this contract and the comparative billing reports, or CBRs, that Safeguard Services creates. And what they do is they compare providers to their peers and do a data analysis, support, and tracking for CMS on specific services. Again, CMS will look at where they're spending the money, and then, of course, those are going to be the areas that they may assign Safeguard Services to look at. Safeguard Services does have a report on podiatry services and foot care, and so slide number 5 actually gives you the information highlighted as to what they actually did. You can find that full report on the Safeguard Services website, and it's under the report section, and then it'll say podiatry foot services. The dates of service that the CBR looked at was from July 1st of 2009 to June 30th of 2010, and the claims would have had to have been processed by November of 2010. Specialty 48, which is the specialty category for podiatry, and it compared to the average of this provider state and national peers. It looked at the percentage of 11721 compared to 11720, and it looked at the percentage of the nursing home visits as well as the level 4 and 5 established patient visits. And it also looked at the average and maximum number of beneficiaries seen per day for debridement of nails in the office and the SNF setting. So what they were taking a look at was what was the average number of patients seen using the nail debridement codes in the office per day, and what was the number of sniffs. Obviously, they were looking at trying to find perhaps providers that were billing for nail debridements, but
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo, or sign up at supercoder.com for a 7-day free trial.